to give you just a little bit of background, is everyone in here pretty familiar with hospice? Like, is there anybody that has not had hospice touch their lives in some way? So maybe a little bit unclear. So hospice is really, if you think about the origin of the term hospice, hospice is actually stemmed from a Latin word that basically means to host and to nurture, okay? And so the old kind of hospice philosophy came from actually more of the church, where travelers that were sick or weary and needed help along the way could to seek some comfort and some refuge and whatnot within these old hospice programs. This was hundreds of years ago. Well, what we know of hospice as a healthcare type setting now actually stemmed from a social worker in England by the name of Cicely Saunders. Okay, and she's really a fascinating lady in that she started as a social worker, then went to nursing school and became a nurse, then went to medical school. And so she was a social worker, a nurse, and a physician. And her whole outlook on hospice care was, how do we provide care at the end of life to a patient where we're not necessarily going after them with radiation, or we're not necessarily going after them with chemotherapy type agents, but our sole mission is to make them comfortable, to make their whole quality of life towards the end of their life as pleasant as possible. So really, hospice is not the care of people that are dying. It's really more of assisting people who have terminal illness celebrate the life that they've lived. Does that kind of make sense? So, to put a little bit of background around how all this has come about, the first hospice in the United States was developed as a pilot program in the early 1970s in New Haven, Connecticut. And really what they did was they tried to bring together people who specialized in something called palliative care. And palliative care is basically symptom management. We're not trying to cure the disease. We're not trying to prolong their life. We're trying to make the patient as comfortable as we possibly can, whether it's shortness of breath, pain, chest pain from end-stage cardiovascular disease, whatever it is, we're going to try to make their lives as comfortable as possible. In the 80s, what wound up happening was Medicare grabbed onto this, and they found that, well, this really is a great way to take care of patients, okay? Instead of having patients die in intensive care units in a hospital, how do we help them die with dignity and in comfort in their own home around their loved ones, okay? And so CMS developed the hospice benefit, okay? So our understanding of hospice in the U.S. really is a vehicle for the provision of palliative care, which is symptom management, under an insurance umbrella. So, for instance, if I have Medicare, so if I'm 65 and I have the Medicare benefit, if I get referred to hospice, okay, if my physicians feel that my prognosis is 6 months or less, I can get referred to hospice, and if I accept that hospice referral, basically what then happens is I say, okay, I'm going to give back my Medicare coverage, okay? You don't sign on the dotted line forever, but I'm going to give back my Medicare Part B coverage, and I'm going to take hospice coverage, all right? And then at that point in time, hospice becomes responsible for everything associated with the care of that terminal illness. So if it's cancer that is your terminal illness, then the hospice is responsible for the nursing visits. They're responsible for any medical care you might receive. They're responsible for the medications that we need to provide pain management or palliative symptom management, okay? All of those things fall under the hospice benefit. Now, one of the things, and I'll get to this in a little bit, of where do pharmacists fit into all of this is there's a lot of struggle going on right now, like as we speak at the federal level, about do hospice patients still have their Part D coverage, their Medicare Part D coverage. So that gives you kind of a quick and dirty rundown of how hospice works. Now, through the CMS Centers of Medicare and Medicaid Services, they have very strict guidelines on how a hospice looks and how it operates, okay? Number one, it has to be interdisciplinary. So that's good for us as pharmacists and future pharmacists, right? It's got to have involvement of a medical director, nursing, social work, clergy, therapists. They have to offer bereavement counseling to family members and loved ones of the patient after they've expired. There's a bunch of things that go into it. And with these new CMS guidelines for participation now, they also mandate that there is annual medication reviews by somebody that is experienced and knowledgeable in medication therapy management. That's good news, right, for us. So that really plays a large role in getting pharmacists involved in hospice and palliative care. So what winds up usually happening is let's say that I am referred to hospice and I'm assigned to a team. So my team would have a medical director, a nurse, maybe a case manager, a social worker, depending on which hospice, and I understand that you all are talking about partnering with BJC. They have music therapists, art therapists, I believe that they have a massage therapist, they have occupational therapists, they have all these different groups that are involved with the care of these patients. And what they'll do is they'll get together, usually once a week, maybe every other week, and they'll, through interdisciplinary team meetings, they will discuss the holistic treatment or care of this particular patient. And as a pharmacist, you would be amazed at how much activity you actually can have on those interdisciplinary teams. Now, I know we're talking about volunteer work versus the actual health care of a patient and your role as a pharmacist versus a volunteer, but I'm trying to get you guys ginned up a little bit about, hey, this is something I could maybe do an APPE rotation around, or even this could be a niche for me when I get done with school, because I have several friends that all they do is consult with hospice organizations and serve as their quote-unquote expert at medication therapy management, right? The other big issue that comes into play, and this is where I thought it was fairly exciting for our purposes, is that now, in order for the hospice to cover the medication, because remember, so if you give back your Medicare and you take the hospice benefit, really what you're saying is that hospice is now responsible for your medications, the cost of your medications. And what comes into play is they're only responsible for medications that are associated with the terminal diagnosis of why you've been referred to hospice. So a great example of this might be, let's say that you are referred to hospice for metastatic pancreatic cancer. Okay, pretty painful, nasty type of malignancy, right? Now, do you guys think that the patient's morphine should be covered by the hospice? You guys think that would be related? Sure, I agree with you. What about the patient's beta blocker? Should that be covered? No? Yeah? Is it directly related to their terminal diagnosis? It's not. Should the patient be responsible for having to cover that out of pocket? Or should Part D cover it if they're 65 or older? And that's where a lot of this argument is coming from, is they're looking for pharmacists to basically write the relatedness argument or the non-relatedness argument. Because Part D may say, look, they have this malignancy, and if their blood pressure is up because of the pain that they're in, so they need this beta blocker. And the hospices are saying, well, really that's not part of our realm, and so we're not going to cover that medication. And who's left in the middle? The patient. One that we frequently will see is somebody who potentially gets referred to hospice for end-stage dementia, okay, or Alzheimer's disease, and they are on hydrocodone for osteoarthritis, right? Well, according to CMS and the Medicare Part D people, they say, hey, this is a hospice patient and they're on an analgesic, you guys should be covering. And in reality, that's not a related part of the terminal diagnosis. And so who gets stuck in the middle is the patient. And this is all unfolding right now as we speak. In fact, the public comment period on all of this just closed down last week. And so CMS is going to be trying to get some rules around this. And pharmacists are going to play a very large role in how all this unfolds. So like the Academy of Managed Care Pharmacy at the national level is ginning up to make some policy recommendations around this. The national level ASCP is ginning up to make some recommendations around this. So there's a lot of attention in this area right now. Any questions about hospice, palliative care, kind of the background of it? We pretty clear? Really, there's no bad questions. I may not be able to answer them, but anything at all. Yes, ma'am.
So as for the, new policies that we're coming up with, would one possibility be to expand the criteria of like whether or not cancer patient's condition can be covered under hospice, such as your dementia patient?
Well, that's a great question. So what can be covered under hospice? And that's why there's a lot of gray area around this, because any disease state or any terminal illness can be covered under hospice as long as two physicians certify that their prognosis for the patient is 6 months or less. So realistically, if I had two physicians say that I could die within 6 months from my male pattern baldness, I could be a hospice patient. Does that make sense? So really anything goes as long as...
That doesn't make sense. I'm asking like, on the policies that they're trying to push, like what would those be in regards to?
The policies that we're having problems with right now really stem around who pays for the medications. And so because this is our world, we need to have involvement. And the hospices are all scared because they don't know how they're... If CMS says you're paying for everything, regardless of whether it's related to the terminal diagnosis, it would break them. Because how hospices are paid, so if I'm admitted to a hospice under the CMS benefit, that hospice gets a set amount of dollars for me for my entire care, medical care, nursing care, drugs, hospital bed, IVs, whatever it is you as a pharmacist recommend that patient needs. I am responsible for paying for that out of my set budget. And right now in this area, like in St. Louis proper, the average reimbursement for a hospice patient per day is $130. Only $130. So that's got to cover their drugs, medical care, nursing care, everything that goes into it. So you can see how this can get pretty cumbersome. And the average drug cost per patient per day in the US right now, depending on whether you have a pharmacist involved or not. No pharmacy involvement, so if they don't have one of you all advising them on how to handle their drug cost issues, the average drug cost per patient per day in the US for hospice is $14, right? So that's almost 10% of the total money they get in from Medicare goes towards drugs. If there is a pharmacist involved that has a hospice or palliative care background, the average drug cost per patient per day drops to around $9. Well, I know that's only $5, but when you're talking about 300 patients, or for BJC, thousands of patients, that's a huge issue, right? But more importantly than that, are we giving the patients the right stuff? Are they getting the best care that they can? Does one size fit all? And sometimes they don't, right? If they're in hospice because of chronic renal failure, well, morphine may not be the best pain drug for them, right? Because of the nasty metabolites. It may be this drug over here that's a little more expensive. So a lot of this goes into how do we take care of these patients in the best way possible. Great question though, thanks. Anything else? Any other comments before I get rolling? I'm not used to having such a large percentage of people awake when I speak. I like it over here. So let me tell you a little bit about the Hospice Volunteer Initiative. So if you look at the demographics of a typical hospice volunteer, okay, and I'm going to spend some time talking about volunteerism, what they do, what could be expected, and kind of the different levels, the way we propose it. Hospice volunteers really can do anything, okay? But the important thing to keep in mind is that they're not part of the healthcare team. Okay? They can be involved in the planning. For instance, let's say I'm a volunteer and I'm assigned to you as a hospice patient. I may be asked to come to the interdisciplinary team meetings and say, where is Joe having problems? Well, Joe's having a lot of problems ambulating to the toilet, or can't cook for him or herself, or having issues here. Or, you know, I noticed that Joe's son was getting into their pain medications the other day. You know, non-medical care type things, but certainly important in the overall care of the patient. All right, so that really limits the involvement of the volunteer. Most hospice volunteers, if you look at the average across the board, most hospice volunteers are over the age of 65, and nothing against people over the age of 65, especially as I quickly race to that age. But 30% of them are actually over the age of 75 and are women, okay? Nothing against women, nothing against people over the age of 75, but we have a very large unmet need of young, energetic volunteers for these patients. Because what we see is as we grow our understanding and our recognition of hospice and how wonderful this program is to a patient and their families, we're starting to see younger and younger patients, okay? When I first started in all this, most hospice patients were older cancer patients. And now we're starting to see pediatric hospice patients. We're starting to see younger patients that might have terminal illness that have chosen, hey, look, I don't want 40 rounds of chemotherapy and surgery and radiation. I want to live my last 6, 8, 12 months to the fullest that I possibly can, okay? And what's left is we have no volunteers that are in the same age demographic and can relate to these patients. And that's where you guys come in, okay? People who know what's going on can have a realistic understanding and discussion with these patients about what they're experiencing and can help them out. You know, there are things physically that you all may be able to do that a 75-year-old woman may not be able to do, right? The timing may be different. Maybe we need hospice volunteers late at night or early in the morning or something where a typical hospice volunteer may not be able to provide those type of services. So with that said, the way that all this got started is I was asked to serve as a class advisor over at SIUE School of Pharmacy for the graduating class of 2015. And typically the classes over at SIUE, they will identify like a community service learning project or something that their class as a group is going to try to make an impact in the community with. And usually it's blood pressure screenings or cholesterol screenings, diabetic foot inspections, something along those lines. And I just pitched to them, hey, here's an unmet need. It's not something that's been done before. What if we go through as a big group and become certified hospice volunteers? Well, we had a fairly decent response to that. However, typical hospice volunteer training for very busy professional level college students can be cumbersome. It can be anywhere from 16 to 24 hours of training. And a lot of it is stuff you guys already know. What is HIPAA? What is Medicare? What are all these things that you guys have already gotten as part of your studies? So what we decided to do was start this initiative where our job was to generate noise and excitement and awareness and understanding around hospice on the SIUE campus. Not just the pharmacy school, but the whole campus. How do we recruit and train volunteers and then deploy them out to regional hospice programs? And how do we help these hospice programs who are used to communicating with 75-year-old women? How do we bring them into you all's communication age? iPhone apps and twitting and Pinterest, I don't know, what all the other stuff that people communicate with, Instagram. How do we get them on the same page as you all, right? Because if we have, let's say, 35 people in here, how do I get 35 volunteers mobilized for a specific event if I'm having to call each one of you? Are you available at this time or that time, right? And so that was one of our other goals, was to be able to help them communicate with you all. All right? Make sense? So let's see how this works. So I basically told you what our objectives were. Our pilot hospice partner program was Hospice of Southern Illinois. They are the largest hospice organization south of Springfield and cover, all the way down to the Kentucky border and up close to Springfield. So they're a relatively decent-sized hospice. And we talked a little bit about what hospice actually is. We're not trying to prolong life. We're not trying to hasten death. We're trying to make patients comfortable, okay? And the cool thing about this is, so the student class over there, they decided that they were going to brand this. They wanted to market, they wanted to make this as bright and flashy and obnoxious as possible so that normal students walking by in our university center would be like, what is that crazy bright orange stuff going on and what's happening? And we'll stop by the booth and find out. We had little jelly bracelets made and pins and hats and shirts and the normal stuff to get people excited about this. And so they came up with their logo and the name and kind of the whole branding around it to get people excited about volunteering and getting to know what hospice actually is. This is just an overview of our committee leadership. These are all class of 2015 folks. And then there are 3 representatives from our ASCP chapter, which is our organizational chapter that we run everything through because they were an already established student organization. And it seemed like a great fit, right? ASCP, consulting pharmacist, hospice. It was like peanut butter and chocolate, right? So where we're at, and these numbers are a little bit dated as of right now. This was just a presentation I gave to the SIUE Board of Trustees several months ago. But where we're at right now is we have people who are interested. So if I come to your class, for instance, and say, what do you think about this? Are you interested in signing up and getting some more information? Really what we have now is we've had 500 students, faculty, and staff that have signed up. That number is now at 650, okay? Of those, the people who have gone through all the modules to do our training is flirting with about 300. And that includes nursing students, social work students, pharmacy. We have a lot of art and music therapy majors. We have some kinesiology majors that have taken an interest in this. And if you think about some of the things that go into like sports medicine and kinesiology, some of it makes sense, especially if you have patients who are immobile and need help with passive range of motion and things like that, okay? And as of right now, we are just shy of 1,000 volunteer hours that have been devoted to area hospices. So right now, we started with Hospice of Southern Illinois. We also partner with Family Hospice in Belleville, BJC Hospice in Alton, and we've done some work with BJC proper over here in St. Louis. But really, BJC proper over here wants you guys, right? Because you're close. You all are not freshmen in college. You all are graduate level university students that are more mature, know what's going on, are very articulate and sharp. You catch the drift. So this may be a win-win for everyone, okay? So the big issue behind all of this is how many of y'all have 18 to 24 hours? Not like a day of some training, but 18 to 24 hours to devote to becoming a certified hospice volunteer in your curriculum right now. Everyone have that much spare time just laying around? I don't, right? And so that was the big issue here is that how do we condense this training into what you guys need to go out and do what the hospices need you to do without taking basically 3 straight days of your time away. So what we decided to do was develop the training around the university student. So it's all web-based. The training videos are realistically at my level of attention span, which is about 10 minutes. So each one is 10 minutes. There's 6 of them, and then if you want to volunteer in the hospice home, the inpatient hospice unit, there's 2 extra 10-minute trainings. Now, they can be a little dry. We try to keep them short and sweet. The glare on my head in one of them is terrible, so you'll have to adjust the contrast on your computer screen. But basically, we developed these with you all in mind. And what we want to do, and what we'd love to partner with this, is who wants to hear old, crusty people teaching you about this stuff? We want to take volunteers that are your age, your level in life, and redo the training modules so that you're listening to one of your peers give the training, not an old crusty college professor, right? And so that's where these are going to go, and we plan to redo these in the fall and have some funding to do that. But as of right now, these things are on YouTube. You can go out and watch them now if you want. If we were to bring this over to STLCOP, probably what we would do is mirror what we're doing at SIUE, where the training videos are loaded onto our version of Moodle, and then you would watch the video, and then the assessment questions are like 3 questions long. And what we would do is then take that to area hospices, or you all would take those to area hospices and say, this is the training that we've done. Here's the certificate that our group has given us, and we're ready to go. Okay? And the philosophy behind this is that most hospices have a very narrow way of looking at their hospice volunteer. And the reason for that is, remember those CMS conditions of participation I told you about, the requirements around hospice? They absolutely mandate that 5% of all hours that are logged by a hospice, whether it's nurse, pharmacist, doctor, whatever, 5% of all their hours are logged by volunteers. Okay? So hospices have to have volunteers. They have to train volunteers. But they have very different needs for their volunteers. You may be a hospice volunteer, and you may be running to the grocery store for a family. You may not necessarily be sitting right next to the patient at their bedside during their active dying process. Some of you may not desire to do that. Some of you may not feel that's something you want to experience, but you still want to give back. A great example is we had BJC Hospice of Alton contact us and say, look, we have a gentleman who is probably got 2 or 3 months left to live in November, and every year he decorated his house for Christmas. He prided himself on being the most obnoxious Clark Griswold house on the block, right? If you've seen Christmas Vacation, you know what I'm talking about. And they called and said, do you all have some volunteers that you could send over to hang Christmas lights for this guy so he could go out and see his house decorated one last time? You know what I'm saying? That kind of gives me a little bit of chills thinking about what a big impact this had on this patient's life. But our volunteers weren't anywhere near the patient during his process of death, or didn't even have to communicate with him. Now, does that necessarily mean, does you all going out and hanging Christmas lights, do you need 18 to 24 hours of hospice volunteer training to do that? No. And so what we have proposed is, if you all want to do things like that, to do what I call hospice volunteer light type activities, then we can do that with a minimal amount of time investment. If you decide that what you really want to do is be by the patient at their bedside, talking to them, reading them stories, whatever it might be, then there may be additional hospice-specific training that they'll want you to do. But our proposal is, if we're going to do things like this, or we hosted a 5K to benefit one of the hospice foundations, our training is sufficient so that you know what's going on, you know what hospice is about, you know the rules and regulations that they are bound to. And for people at your level, that shouldn't take 18 to 24 hours. It's realistically 2 pages of material. Agreed? So that's what we did. We kicked it off November 14th of last year. We had a live training just to get everybody to come and get their certificates. We give out everybody that goes through training a ridiculous, obnoxious bright orange shirt with the logo on the front and in big, bold, white lettering on the back, volunteer across, so that when they're out wearing these shirts, volunteering for our group or for your group, people come up and go, hey, what is this all about? The t-shirt looks cool. How do I get one of those? Right? And that was just kind of our philosophy of how to get these around. it also doesn't look too shabby on a CV for people who are looking for jobs or residencies or whatever, to be able to show, look, here's what I did, right? Now, here's where things get really crazy. So one of our pie-in-the-sky ideas was, look, we're dealing with university students. We're not dealing with 75-year-old ladies anymore. How do we communicate these needs, these opportunities to the students quickly? And so 3 of our volunteers just happened to need a senior research assignment, and they happen to be computer science majors. And so they developed for us and put through usability studies and beta testing our Hospice Volunteer Initiative iPhone app. And it will be available for Droid probably by the fall. So you download this app right from the iTunes store. This is what it looks like. And when BJC Hospice says we need somebody to go hang Christmas lights, or we need somebody to come help with a benefit, to help out benefit our foundation or whatever it might be, they can load the event into their side of this system, and then your iPhone dings, or you get the little icon, and you pull up your app, and it shows all the different opportunities that you have to volunteer. So let's say I opened up this event. This was a Big Bang Theory viewing party, okay? And I decide I want to go. I click sign me up. You can dump it right into your calendar, and also it will open your iPhone map so that you know where to go, okay? And usually there's a little description of what we need and how many people we need and all of that. As soon as they filled all their RSVPs, so they need 5 students to go hang Christmas lights, as soon as they get 5 RSVPs, then it will automatically pull that event off of everybody else's app, so that there's not 50 people RSVPing and then they're like, hey, we're good, we don't need you anymore. Okay, so it's a very intuitive system with real-time communication back to the volunteer coordinators. The other nice thing about it is that it will log all your volunteer hours. So when you're done, if you spent 6 hours at the Big Bang viewing party, you click in how many hours you have, and then it not only keeps track of it for you so that you can say, hey, you know, I dedicated 1,000 hours of volunteer service to area hospices, but it also will push back to the volunteer coordinators so they can submit their reports to CMS every quarter. Make sense? So this is pretty crazy stuff, but it's there. If you go to iTunes, it's under Volunteer, Hospice Volunteer. It's the only app, okay? And it's free. But what we do is on our end, like for instance, if we were to set this up for STLCOP, for you to take to your partner hospice organizations on this side of the river, then there would need to be an administrator with administrative rights on the back end that, let's say that I signed up on the app under, you know, Joe Schmo, somebody would need to be able to say, hey, Joe Schmo hasn't finished his volunteer, we're not going to activate him in the app yet. Okay, so you can download it, you can sign up, but you don't get events until you've completed the training. Cool? All right. Oh. So this is a picture of our first cohort of volunteers that we put through the program. This was just shameless self-promotion. We got the SIU Community Service of the Year award last year, so we're proud of that. And we've had a lot of help along the way. We've certainly not done this in a vacuum, but we met as a group and we identified what are the next steps for us. And our next steps, what we want to do is we want to help other institutions do something similar. You know, a lot of work and a lot of man hours have been put into logo design and t-shirts and all of the other stuff and the training modules and all of those things. Now what we'd like to do is see other campuses that are interested in doing something like this. We want to support them get this off the ground if they're interested. So, you know, obviously this is, you know, probably some conversations to have with, you know, your student leadership and us and the administration with the college, but we are actively seeking funding to help provide resources so that you all aren't having to try to do all of this on your own, recreate the wheel. We provide the wheel to you, and you just start pushing it until it starts rolling. Any questions? That's kind of my 30-second spiel in 40 minutes. You guys want more examples of things we've done? Would that help? I told you about the Christmas lights. We hosted a 5K run walk about 2 months ago that raised $8,000 for one of our hospice partners for their foundation. And things that they use their foundation money for are, let's say that there is a hospice patient and they have, I don't know, 4 or 5 kids strewn all over the nation. And it's time for them to come see mom or dad, right? Maybe the prognosis is a week or 2 and we want to get their family back home. Well, some people don't have the means to buy an airline ticket, with 2 weeks notice at $1,000 from the Northeast. So the Hospice Foundation will do things like that. They'll pay for airline tickets and help things along those natures. They'll pay to have wheelchair ramps put in at people's houses. Things like that you don't really think about helping somebody die with dignity in their own home. So part of our mission is to help these foundations. I think BJC's foundation is called Wings, and we want to try to give money to them. So, we may host fundraisers to push towards Wings. Every year, Wings has this huge gala at the what's the fancy hotel in Clayton? The Ritz-Carlton, and they had it a week or 2 before Christmas, and they call it the Big Bear Brunch. And that sounded very interesting to me, so I volunteered as a HVI representative and went and was handing out bears and doing face painting, and but it was for kids, and it all benefited the BJC Hospice Foundation, specifically for hospice services for kids. So, if there's a child that's in hospice, they may arrange to have, a party or clowns or, kind of along the lines of Children's Miracle Network. So it's really a great organization. I tell you what, when you get done at the end of the day and you've done stuff like that, man, it leaves a really good feeling in your heart, I'll tell you what. We've helped design floats for hospices that want to increase their community involvement. Students are good at making floats. I don't know where that comes from, but they've done a great job at actually designing and building and doing the carpentry around helping a couple of the small hospices in the area develop floats. And really what our involvement with our lead hospice organization has led to is now we have just signed the deal within the last couple of weeks that they've been so impressed with the pharmacy student volunteers that they've now designed and implemented an APPE rotation for pharmacy students around hospice. So not volunteering, but an actual last year rotation, because they recognize that you guys are the best and the brightest, right? Rah, rah, pharmacy. So what are some other good examples? Our volunteers that have done the volunteer light training with one of the smaller hospices will manage a booth over the Christmas holidays in the big mall where we live and design Christmas ornaments for sale to benefit. They have done blanket, I don't know, what do you call when you make a blanket? Knitting, sewing? I don't know, beyond me. But some of them love doing that, and they had this push where every hospice patient got a blanket for Christmas. And so a bunch of them got together and worked on that in their own time. So, the other thing is people who have, it may not be that your skills as a pharmacy student are what BJC or other area hospices really need. You may be a videographer at heart, right? You may be the next Steven Spielberg that just hasn't found his way yet. And some of these hospice patients really enjoy recording their story, their life story. We had one hospice patient that his big thing was music. And he was an old band teacher. And so one of our volunteers that was a music major went out and jammed with them. I don't know what the terminology is for music people. We had an old artist in one of our art majors went out and helped them report that he actually needed help painting his last painting. So those are just some examples of other ways that volunteers can get involved without necessarily being in what you would call a stereotyped hospice volunteer role. Okay, I'll be quiet. I've been rambling. What do you guys have for me? What questions you got? Yes?
So I know you said that these light, like the use of the light modules, you can just look up online on YouTube and stuff. But how do you, I don't know, I guess certify, like, yes, I did watch these 6 and I want to volunteer?
Well, that's a good question. A lot of that, I think, would depend on the communication that follows. Like if there's a lot of interest from you all back to the student leadership, we'll figure those things out. Right now, we have maybe 10 to 15 volunteers that are not SIUE, okay? And so we put them up there, and then we've been having them do paper quizzes, and it's kind of a nightmare to arrange it for non-SIUE people. But if we can load those things onto Moodle for you, I mean, you can go watch the videos, but in order to actually certify that you did them, there's small assessment tools at the end of each module that whoever is running the program needs to be able to go, yeah, they're done. They completed it. Here's your certificate.
I'll put a sign-up sheet in front for afterwards. Whoever's
But that's a good question. If you're really hankering to get started, I'll send you the link and you can go back and do the assessments later. I mean, most of it, honestly, is what I talked about today. So you guys could probably pass all the assessments. Don't do it, watch the videos, but you could probably pass all the assessments just on what we've talked about. What else you got?
Hold of Brian Browning real quick too, so we can get that uploaded to Moodle sooner than later.
You guys are quiet on this side. You got to have something. Did you guys just come for the food? Questions over here? Excited?
I mean, I know for just hearing about it, starting a whole, like, would this be incorporated into our organization that's already? Or do you think, like, I just know people don't necessarily in the professional years, they've already gotten involved in lots of things, so taking on more leadership to make this run, like, I think people here are willing to volunteer, but not necessarily ran the whole thing. So I don't know if there's any way, like,
Well,
you guys have,
I can
Where
share
we can
our
be,
pains with you.
I don't know, I don't know who the person would be behind verifying and getting up that we need to go put up Christmas lights here necessarily.
yeah, I mean, well, for right now, I'm it's with ASCP at our school. ASCP might be with SPA in the future, maybe for next year. It just depends on how many members we have, and I think it shouldn't be a problem for next year. But right now it's with ASCP, and I'm the hospice chair, so I'll probably take care of like that aspect of it for now, and then in the future maybe somebody else would take on that role. So
My advice to you is get young, like first-year students before like ASP gets
yeah. there's a lot of first and second years that were like sending me emails. So
Well, and the other thing too, to answer that question, is if you can put your relationship with the hospice together appropriately, the ideal situation is your job is just finding the people, right? Once they're trained and they're certificized, or whatever the word is, then the hospice should be able to communicate with them directly. So, I mean, if I'm Herndon Hospice and I've got 50 STLCOP volunteers, I shouldn't have to go through you to get to you guys. It should be, you know, we're using Facebook. We have a Facebook page. We use the Moodle, and we use the iPhone app. And once we get the Droid app up and all the bugs worked out, then we'll probably go completely to the smartphone, iPad stuff. But that way, you know, that your contact at BJC Hospice can say, hey, we need Christmas lights hung, and push it out. And it shouldn't need to go through any of your leadership, right?
oh wow, so the hospice would act as the app themselves and then post the opportunity.
Yes.
Oh, wow, so that's
So
really streamlined.
and what we're really working on right now, and this is kind of behind the scenes stuff, is the way we develop the database and the back end of the programming is that each individual hospice will have their own administrator code. So for instance, let's say you want to do BJC, and let's say you're from Farmington and there's a hospice down there that you're at home every weekend. We can load the two different codes in where you might get notifications for both. You only get notifications for the one that are here. So all of that's been programmed in already. We just we haven't had the need to use it because it's just us and our hospices.
Right.
But that functionality is there. Yeah.
So from this, if once we get it set up here, will we be able to use the app as well? So like with the app, your app that you guys made, kind of trying to get it spread nationwide?
That
Or
is the
it
idea.
Okay.
That's the idea. So, developing those smartphone apps is expensive. So, and then to troubleshoot them and to update them and all of that. So, we do it as we come upon money,
Okay.
basically. But
We don't have the software development.
well, our idea, I mean, to tell you the truth, our end game is, maybe get one other program up and running with the support, with the app, and with their partner hospice organizations. So, you guys are the first ones that have really kind of come to the table that are easy to help get up to speed. And then after that, we'd kind of like to have the hospice organizations maybe chip in some resources to use the app that we've spent so much money making to support further expansion or ongoing costs associated with running the programs. But that wouldn't involve you guys or your partners. Like you all in BJC would have access to the app and would help us be the pilot program. If that makes sense. Yes, sir.
Quick question. What do you see, or what have you seen over the summer when students are back home or not in the same area where they go to school? Is there like a dip, or is there a way around that you guys run into?
Well, the summer, what we seem to be seeing is that it's a different set of students entirely. It's almost like a summer volunteers and school year volunteers that get involved. So the people that hang around the area during the summer tend to step it up in the summer, and the people who go home obviously don't. So, but we haven't really had a really huge problem with filling the needs. And if you can't fill it, you can't fill it. It's a shame. You guys have class at 1?
Yeah.
Okay. All right. Well, thank you for your time and your interest, and hopefully we'll have more info to you soon. Okay?
There's a sign up sheet over here. You can also send me an email.